Hi, everyone. Welcome back. We'll get started in just a moment with the next presentation. I'll give it to Rosana.
Okay, can everybody hear me well?
Yes.
Okay, well, let's begin. It's the top of the hour. So I will begin my my presentation of the host. Good afternoon, everyone. Once again, welcome to Uniting Voices, celebrating Spanish Language Day and promoting healthy literacy. I am thrilled to see so many people in this section today. Thank you for being here. As a Latina, Puerto Riqueña, I am very, very thankful. Now we have an exciting presentation lineup for you all. Our session is titled Tata Tales, Los Cuentos de las Tatas, the intersection of poetry, transformative writing, and drama in bilingual communities. And we have some wonderful speakers who will be sharing their insight with us. But before we dive into the event, let me take a moment to introduce our distinguished presenters, Dr. Beth Murray and Irania Macias. Dr. Beth Murray is an associate professor of theater education at the University of North Carolina, Charlotte. There she coordinates and teaches in the teacher preparation program and also teaches courses in applied theater and theater for young audiences. Beth conducts and both traditionally and creatively disseminates qualitative research that is community-centered, art-based, justice-oriented, and collaborative. Irania Macias is the Reforma Vice President for the Carolinas, a bibliopoetry therapy facilitator, author, and educator who specializes in subjects of art, integration in multicultural bilingual populations, and the connections with literacy and mental health. For the past 26 years, she has worked as an outreach program specialist for the Charlotte Mecklenburg Library, facilitating and creating programs for educational and clinical settings. I am sure they will bring a wealth of knowledge and experience to the table, and we are fortunate to have them leading today's discussion. Without further ado, I will hand over the reins to our esteemed presenters, Beth Irania. The floor is yours.
Well, thank you so much, Rosana. My name is Irania. And so, this is Irania and my friend Beth. We are both in Charlotte, North Carolina. We are so excited about sharing this presentation with you. It's been a beautiful project. And so it's our intention and it is our hope that you find some way, a way to connect to this project. There are many ways that you can connect to this project. So I would love for anyone here to see a way that you can participate in this amazing initiative. So Tatas Tales, even though it's a play, the magic of Tatas Tales is the process. So we are going to share with you the process, and we're going to share the details of this process. So if we can go to the next slide, please. this is our agenda. So of course, you already learned about the presenters. We're gonna give you an overview of this project and the different phases of this project. There is a video that describes in concrete what's Tatas tale. So I hope that the video it will work in the presentation. So then we will share with you a little bit of what's poetry therapy and what is bibliotherapy and why poetry therapy, bibliotherapy. Some of you can call it expressive writing, writing to heal, transformative writing. There's many terms that we use, but we're going to share why this process is so relevant for libraries, communities, and the mental health world and the clinical world as well. Then we're going to share with you kind of the development of the play, the script of Tatas Tales and the performance work. We also going to share with you the status of Tatas Tales right now and the different applications in the medical community. And so then we talk about the learning aspect and what is our hope and how can you find a part in this process, and of course questions and concerns or anything you want to share. And so my work and the way I met Beth I think is very relevant to talk about this because I work for the Charlotte-Mecklenburg Library, 27 years working for the library. I am a bilingual outreach specialist. So that means that I bring the library to the community. So we serve underserved populations. So my programs are in jails. My programs are in foster care centers. I go to senior centers, rehab centers, schools. I mean, it's the world really that I go every day. And it is a fantastic job because we're the ambassadors. And so I have had the privilege of starting this poetry bibliotherapy process through the library. And it is really a therapeutic approach. Many people ask me, is this therapy? And this is not. This is a therapeutic approach. So I always clarify that. But I started to work in hospitals, Levine Cancer Institute, Mercy Hospital, Novant Health, maybe about 7 years ago. And especially I work with the cancer community and the breast cancer community. So when I started my work as a poetry therapy facilitator, I discovered that these women that are cancer survivors had so many stories that are very, they're worth to share. And so after many months of collecting the stories, I have met Beth through the library. And Beth is a professor and an amazing theater director and an amazing theater playwright. And so Beth and I were talking about what is the best language that we can use to share these stories. And we both were like, wow, theater is a language itself. Art is a language itself beyond any, language barrier. So then, Beth, I am going to pass the story to you and how this, this connection now came to you.
Oh, I think we're both have literacy in our backgrounds. We both have children's literature in our backgrounds and being community centered. And so I think it's a pleasure to collaborate with Irania because, there's not a problem that can't be solved with some creativity and imagination. And so it's sort of on that ground that we've done other projects. And then we came at this one. Next slide, please. Next slide. There we go. Next slide.
Yes, so we're here in the kind of a little bit of the goals for this project. At the beginning, when we met with women that were breast cancer survivors, these were our initial goals. So in a way, it started with, the creativity in mental health. And these build resilience and foster intercultural exchange, connect survivor stories creatively, reduce stigma and fear about breast cancer conversations. Those were our initial goals. And these were the goals that we had specifically for the target audience, and that was the breast cancer survivors. Then from these groups that we develop in hospitals, and specifically there is a space called the Pink House, La Casa Rosada. There were women that they were English speakers and there were Spanish speakers, and they go to this place to receive different programs, mindfulness, yoga, drawing, expressive art therapy. So writing and poetry therapy was one of the classes that they took, and I was facilitating this class. So those were initially the goals. Then after several months of conducting these facilitations, then we started to collecting the material, the drawing material, the writing material, and that's how then it evolved into a play script. And the script was done in English and Spanish. Beth and I will talk a little bit later about the process and how important is to pay attention to the process, because it was not a translation. And working, I'm not sure if you have ever write a play with somebody, but working with two people as writers, that was a really beautiful process, also a learning curve for Beth and I, working together as playwriters and also working together in English and Spanish, trying to respect the authenticity of the original language, because some of the pieces that came to us were all in Spanish. So a translation was not enough. And so it was just a very interesting process in writing this script. And then, so that was kind of the second part of this project. And Beth, if you want to talk about the third point.
Sure. And so the script exists and it has been read, and we'll share that with you later, meaning it hasn't been fully produced with all the props and costumes and in a great big theater with projections, but it's been read aloud in front of community a lot. And some of the community where it was shared was with medical folks and folks who work in social service with breast cancer survivors. And those people saw possibilities in the script. And we hoped that they would, because we saw them too. And we're currently working with nursing faculty at my university to use the script and the ways, the arts-based ways of working, to develop curriculum modules for the nursing students in their practicum courses in a pilot way. And so that's sort of the third prong of this. Next slide, please.
So I'm going to share about the poetry therapy aspect and what is a poetry. Many of you maybe know what is this. Maybe this is the first time you hear the word bibliopoetry therapy. This is a program that I took through the International National Federation of Poetry Therapy, and I found this very relevant to the work of an outreach librarian, because when you are out there representing the library, doing programs, especially these days in the world of social emotional learning, there is a lot of people coming to you, sharing their life, sharing their struggle. So there is a very thin line between being a program librarian and a social worker. And so in a way, I found myself always being in between. But so I discovered through poetry, bibliotherapy, lots of the strategies in bringing the voices of people, expressing the voices, falling in love with reading, falling in love with writing, because it's connecting to their life struggle. They convert pain into beauty when they really talk about their own truth, and they walk into their own paradox. And so I found this work very relevant. So the initial poetry therapy groups, really, when we started this at the Pink House, which is the place that we started to do this project, Tatas Tales, the mission was to support Latinas and non-Latina breast cancer survivors to build resilient and foster intercultural exchange. And as I said, is by connecting their stories creatively. when I talk about intercultural exchange, I wanted to point at an interesting aspect about this, because many of us, use the word multicultural and intercultural as the same thing. And when we use the word foster intercultural exchange here, it's when we exchange information among different ethnic groups or among different cultures. And one thing that happened in these poetry therapy tables and poetry therapy groups is that we have breast cancer women from different ethnic backgrounds, from different languages, and they were all in the same table. As one day, I remember Beth said this. Beth said that unfortunately the common denominator is the commonality is cancer, and the cancer journey is what unite these women, regardless of the language, regardless of the background. So there was a real exchange among these women from different countries. They found themselves united. And so that was the initial mission of our poetry therapy group. And if we can move to the next slide, I'm going to share it with you because I know in some of the workshops and some talks that Beth and I have done in the past and conferences, we walk the audience, in this case you, to what is a poetry therapy session. And so you will have really an understanding, because we will kind of create an exercise for you. But I'm just, because of time, just going to briefly tell you what is a poetry therapy session and facilitation, and what are the components and what happens. So basically what I do, I follow these 5 steps, which are the 5 steps given by the National Association of Poetry Therapy that I learned through the classes that I took. So first, you of course, it's kind of a group process. I'm not sure if you have led anything of group process or support group, but once you have the group, you first, the first step is the entry. And the entry process is when I bring the audience to one topic, and I do it through a question. So generally, I open up with a question that it's relevant to what they're living. So the question might be, what is the ambivalence that you're living right now, or what is it that you want to change that you cannot change right now? Where do you feel safe? Where do you feel grounded? What is that glue? So it depends on the topic, but in the entry process, I always open up with a question. Sometimes those questions are already asked before the class, so I know what are those questions. And generally, I bring a piece of literature, and this is the literary part here. I can bring a chapter, I can bring a poem, I can bring a song, I can bring something that is relevant to that question. I can bring something visual, a piece of art. So the expressive arts here are really, really important. So once the people connect the question with that piece of literature is the entry process. So they find themselves here. I'm here. There is something here for me, and that's kind of the hook. The initial. You're part of this. Then there is the second step, which is the engagement process, and it is when we process that piece of literature, whether it's a chapter, a little poem, whether it's a phrase, a quote, but we read this together. And that's when the second step is when the audience recognize themselves in the process. So the third part is when we shared what we just read. And it's most of the time it's anything that comes in mind. There is nothing here. I'm not evaluating how amazing they are in analyzing literature. It's just what is here for you in a natural way. What words are there for you? What is it that is connecting to you? What images are there? Many of these women, some of them, and this is what I find fascinating, have not had experience with reading. And so this is a great opportunity, a very safe opportunity to find in reading a connection. So then after that, they feel they are involved. Then there is the incorporated part, which is when I ask them to write. And so I have always prompts, maybe 6 or 5 prompts the most, where they have to write about these questions that I'm asking. And they do this quietly, and that is a greater connection when this happens. They are quiet, and the therapeutic process of writing. Some of them do it on the phone. They can type over the phone, but I always encourage for them to have, a notebook and a pen, like the old way. I feel this is the most romantic way when you really express yourself writing and using your hands to write. And it is actually scientifically proven that there is a greater connection when you do that. So once they are isolated in a way in the same group, everybody quiet, then they come and they share, and that is powerful when somebody hears from another person something that they couldn't say, but they say it. And so there is a great connection here, and that is the art of facilitation. In this moment is when really you disappeared as a facilitator, and then you give voice to the audience, and they start sharing. One thing that we do in this part is called es el juego de la subasta de palabras in Spanish. It's kind of we buy words from each other. So let's say that you read something that you wrote, and then somebody heard it and they identify with that word or with that idea, then the person who identified say, I'm going to buy you that word. I'm going to buy you that sentence. And so that also, kind of motivates people to talk and to give a feedback of the other person's writing without judging, like, oh, that was beautiful, or you write very nicely. It's more, I buy you this, and the way that they can pay is by explaining why is that phrase or that word relevant to their lives. And so this promotes a lot of participation in a very safe way. And then the last part of this process is the initiative. And the initiative is, what is the step forward? What are you going to do with what you write? What are you going to do after you say that? What is the initiative? What is your creativity now? And so this is also, as a facilitator, a cue for me to know what I'm going to do next, because I know it's a group process. So the group have to continue. Some of the groups that I have had been with me for maybe 3 or 4 years in a row. Sometimes I want to stop them, but they don't want to stop because they really find, an enrichment, a treasure in the magic of finding people that are going through the same experiences. So there was a lot of material that came from before Tatas Tales was called Tatas Tales. And so that is kind of the ritual that I follow, and every time is different. However, these are the standard, the template components for our lesson plan. If we can move to the next slide, please. And so these are some pictures of, using drawing or writing, and women from many different backgrounds. Like I said before, different ages. We have from like 20 to 80 years old in the same table. And if you can just, in these groups, one of the things that I see is the art of expression, the art of mastering their own pain. There is also, they witness each other's life and each other's voice. There is freedom here because they if they don't want to share, they don't have to share. It is just like, say what you feel, know what you should feel. Just there is a lot of freedom in these groups. There is a lot of venting also, in a respectful and with dignity. And I can see through the process transformation. And even though I am not tapping exactly in the subject of cancer, which is the factor that is joining the mental health aspect, I can see a transformation. They say they keep coming, they keep asking for this type of experiences, and the nurses or the coordinators that work for the hospital, they always give me their feedback saying this class is one of their favorite class. They want to keep coming to the class. This is very healthy for them. So I can see transformation. I can see changes perspective, and I can see how many of them come with this fracture, with this sense of loss, with this sense of fear, with confusion. It's not my my responsibility to make them feel better. I don't go there with that intention. I go with the intention of clarifying, see things with different perspective, facing their fears and talking to them. And so there is a transformation, and there is healing in this transformation that we all witness. So if we can go to the next slide, just to see some of the pictures. So we build community because, as I said, there is a whole community coming to this, and even the whole process of Tatas tells, there is the libraries are involved, the hospitals are involved, the Arts and Science Council or Arts Council are involved. Many organizations, Latino organizations in the community have been involved. Universities like Beth University, the UNCC, the University of North Carolina in Charlotte is also being involved. So there is really community building in this process. Next slide, please. And of course, like I said, the art of writing and the art of storytelling and the art of theater, that it's connecting beyond words. We had a lot of fun during this process, and now we're gonna kind of talk about how from writing this, moved toward the play writing, and how that all was transformed into a theater format. So next slide, and I'm going to pass this to Beth now. Oh, I forgot to mention this before. Beth also met Faye Harvin, is one of our participants that she is a breast cancer survivor, and like I said, I gave first a poem, and the poem that I gave at the beginning of the class. This is one class, and this is one of the poems as an example. The poem originally was called "Having Come This Far," and this is her reaction toward the lines "once we follow those 5 steps that I shared with you before." Beth, I don't know if you want to read what
Sure.
Faye
Sure.
said.
Can you hear me? Yes. Okay. Yeah, I'll read it. Having Come This Far by Faye Harvin. My first words were inconvenienced and disappointed. Slowly, my words changed to adjustment. I've been through what my through was to be. I did what I could and couldn't. I was never sure how I would get there. All that I knew was that I had to keep going, and I could only look back to see how far I had come. First, there was diagnosis, then surgery, treatment, then another surgery, recover, then surgery again, recover, then surgery again. Did you just hear that echo? Yet there was a point when I realized that I was thriving through and through, thriving through my through, and then I had to go through an unexpected through, and now again I find myself in recovery. Down the road, I see adjustment, acceptance, survivorship, and then thriving. Yes, thriving through and through and through, thriving through my through. I am a surthriver.
Thank you.
Mhm. Next slide, please. So you can hear from the words of Faye, that's what she writes as poetry. Imagine the conversation with her and the space that she holds for others. And that's really at the heart of what this is. And so this little intersecting Venn diagram here, I think captures the foundation of Tatas Tales. So we really have looking at poetry, looking at theater and drama, looking at mental well-being. All the people at these poetry tables were interested in some way in one of these forms of expression, whether it be therapeutic conversation or literary ways in, or theater and drama and performing things. And so what we sort of always operate on when Irania and I work together is that everybody has a home place in one of these circles that they can find their way in, but it also leads to and connects with and feeds with the other areas. So it becomes generative. Next slide, please. Next slide, thanks. So the playwriting kind of went in these, oops, thank you, went in these.
The one before.
Go back to the phases, back one, thank you. went through sort of 8 phases. Irania has talked extensively about the poetry therapy groups that began in 2018. And then when she was so excited and reached out to me about all the theater possibilities, we started looking at the things that the women had written. We I attended some sessions and listened, and we even recorded them sometimes because their talk was really very rich, but it wasn't the same kind of communication as their poetry, as was their drawing. And so all of these things sort of made it a really layered possibility for a theatrical script. We collected the written material, and then we drafted a script. And of course, it was during the lovely pandemic. And so we did some readings on Zoom and got some feedback. We revised it again in 2021. And then once we got to a place where we were kind of happy enough with it, we Irania translated it into Spanish. So we had a Spanish version and an English version of the same play. And then we sought grant funding to be able to do readings in the community. It wasn't fully mounted productions. Like if you saw the script, you could see we have projections. We have lots of music and moving around and lots of set pieces. We just had them sitting at music stands, as you'll see in some of the photographs, and reading the script so we could make sure we were getting the responses that we needed to keep improving the script. And then we continue, as we're doing now, to curate the project and continue to look for support to do a full production of it, but the script does keep growing. You can see too at the bottom with all of the asterisks, we could not have done it without grant funding from lots of different places. But I have to say, lots of different funding sources were very interested in supporting this kind of work because of the intercultural nature of it, because it was creative, but also because it crossed over between the artistic world and the medical world, and it really centralized community and the words of the people. Next slide, please. Our reading rehearsals were magical. We thought it was a problem at first that, like, what are we going to do? Do we need just 5 bilingual actors, or, oh, nobody's schedule can work? So we ended up with this lovely assortment of 11 women, all up and down from English only or Spanish only to bilingual of varying degrees and comforts. Some people were completely bilingual, but not comfortable enough to perform. Some people could understand the language that wasn't their home language, but didn't want to perform it. And so we sort of brought everybody together, and to watch them watch one another was really great, because it could have been these 5 people go over here and these 5 people go over there, but they really watched and listened to each other. And there were 3 breast cancer survivors among the actors, and their very stories were part of this play. And so hearing people who were not breast cancer survivors talk about the stories that they were bestowed to perform from the person sitting next to them was quite powerful. And even like as Irania talked about in the poetry therapy groups, people would hear someone else's story and that would make it safe for their cancer story to come forward. That happened in this group, and it really was just humanizing. Next slide, please. This again, more pictures. There's the gang. Next slide, please. And in the performances, you can see what we mean by staged readings. They held the scripts in their hands. They had a similar costume. Everybody wore black with some pink accent, and anything from Converse, Chuck Taylors to pink scarves. And you can see too, that's a picture of Irania standing at the door of one of the rooms of the Pink House. It wasn't, these things didn't, some of them happened in traditional theater spaces, but a lot of them were in community spaces. So this was really coming back to the room where some of the women wrote their poetry and were part of their sharing sessions. Next slide, please. This is one of the Spanish-speaking casts and one of the English-speaking casts in their concert readings. Next slide, please. And again, it was about their performances, but it really was about so much more. And again, you can see across the bottom there, the funding sources, the people who gave in-kind space and support. We always had a hard time squeezing all of our supporters onto our poster because there were so many different ways people could be involved, not just financially. Next slide, please. And there was one at staff day at the library. This is not the same cast, but when it was Breast Cancer Awareness Month, we assembled a group of actors to do a reading for library staff so that they could again see the possibilities here, but also know what was happening in their very community. Next slide, please. So we want to share a video now that will give you an idea of the big picture.
I don't know if we can hear it. I'm not sure if everybody can hear it because I cannot hear it.
I cannot hear it either.
About 2018, I started to do a transformative writing class with the Pink House. And these women are, breast cancer survivors. And I did this in English and in Spanish. So I had two different groups. But as I was doing the transformative writing class, I found so many common journeys, so many common stories. And I said, wow, this is really cancer, breast cancer. It has been a common denominator for these women to share their struggles. And I felt like the community have to hear their stories.
Being involved in this play, I think the last time I was involved in a play was as a kid. So definitely not as an adult, and I'm by far no actress, but it's really fun and to meet other women who have gone through the same and other women who give their time to come together and do the readings. And it's very powerful. I don't think, actually, to my knowledge, a play like this has been done before.
Theater was really the format, the best format to reach other communities and go beyond a language barrier.
Cuando oí de tu parte que iban a hacer una obra de teatro, aparte que me encanta el arte y me encanta estar colaborando con la Casa Rosada, y sobre todo con esta terapia de escritura, dije, no, tengo que estar en español porque me encanta el castellano y por eso estoy muy contenta en ser.
And they were always afraid, like, I'm not a writer, I don't know how to write. Excuses. Yeah. So many people, it's like, I don't know how to write. And then discovering that it's not about the quality of writing but it is about the authenticity of their voice and even giving them a space for them to have a voice and say, I am more than my cancer. And but the beautiful thing is one person story or writing connects to the other person. That connection is really what heals. And seeing that they're not alone and hearing something that is very helpful for themselves, for their struggle, for whatever they need to hear. It's kind of a magical thing because they hear from somebody else the phrase that they need to hear to respond to something that they might not be aware.
Listening to the words coming from the pages and how I feel is that it illuminates all through my body. It's more so to hear it from other women that are around me as well and being able to see and feel their emotions.
I think one of the anchors for me was from that time when we recorded the session verbatim of people telling their stories of when they first found out that they had cancer, had breast cancer, or had transcribe those recordings and just look at them and not change a thing, you know, because it really humanized it. And I think the first go around though, we were more sort of this patchwork of trying to represent everybody. But when we read it, do you remember, like people's responses were kind of like, I'm trying to follow one person's story or a few person's stories through. And so I think that made us go like, okay, we need to really define these sort of 5 composite characters, but they need to be connected in some way. And so I think that sort of the rewrite was really trying to still respect the stories, but weave them.
We wish that our next phase is really connecting to the medical community and still explore how this script can be transformative piece to the not only the breast cancer community but also the service providers, because they can exactly hear what is in their hearts.
It's a unfortunate unifier. Like I think people have said over and over again that it's like once you say it out loud that, you know, if you're a breast cancer survivor, if you're in the midst of something, that gives other people license to come forward with it. And it's astounding how many people are in a room that it's touched their lives. It's touched everybody's lives in some way. But we don't always have the freedom or the catalyst to let it out.
And so why me? Or
why not me? Yeah.
Well, thank you for watching the video. And we have a Facebook page in case that you want to follow the stories of these women, and in case that you want to see this video, that you can just see, you know, what like the way that people also interact toward this project in our Tatas Tells Los Cuentos de las Tatas Facebook page. Now we're gonna move to the, you know, the arts-based medical curriculum modules, and Beth, if you can, you know, elaborate on that part.
Sure. Next slide, please. So we've talked all along about wanting to sort of connect with the medical world. And we really had a lot of learning experiences where it's like people would be supportive of this and really love it. But it's like, where do we fit at somebody's convention, you know? And it was kind of, we had several people ask us to sort of be the entertainment, you know, the interesting thing after people had been sitting all day. And it was great to be able to do that, but it's like we sort of wanted to be able to move, not that it's like we're bringing you something and giving it to you, but how can we be in collaboration? And so we were so fortunate to be able to really key into these 2 ideas, that arts-based approaches can help humanize medical learning, right? It's so much about the clinical piece and the right diagnosis and which thing means what, but it's human beings that this is happening on. And then the other part is that arts-based approaches embrace and often embody multiple perspectives, multiple right ways, you know, so that it's complex. And I think we were anxious to sort of find those connections and work with folks on that part of this work. Next slide, please. There you go. Thank you. So here are our 3 awesome nursing colleagues that are across campus from me, Katie and Charlene and Corey, and they all joined in on getting a grant from the Women's and Girls Research Alliance here at UNC Charlotte to explore curriculum for the nursing students. They work with nursing students that are in their practicum phases when they are getting ready to go out into the world and really put things together. Next slide, please. So what we've developed, we're actually in the midst of doing this now, is two kinds of modules. One is video-based with discussion. So our nursing colleagues went through the script and they identified a couple of scenes that they thought would be really useful for their students to be able to see. And we're getting ready to film those, and there'll be about a 10-minute film of the scene, and then there'll be discussion that follows that. The two scenes that they chose, one was folks sitting in a waiting room filling out those forms of all of your diseases that you've had in your medical history, but you feel like you're by yourself, but really the person right next to you is doing the same exact thing. Yes, so if you imagine that conversation happening. So that's one of the scenes. And then the other scene is one where it's the doctor and the patient, and it isn't all that comfortable. And then at some point, those two shift, and then the patient takes control and kind of gives a lot of questions and information to the doctor. And those things grew out of the writing from the poetry therapy groups and the talk of those participants. And so those are the two that are in the works to be video-based modules. The other kind of modules that we're doing are using arts-based methods, particularly a thing called forum theater, where there's a scene happening and folks are able to play the scene, and then people on the edges, the spectators, but we call them spect actors, will be able to tag, freeze the scene, jump in and change something. And so with the idea that it's like you don't just get one chance, there's not just one way, but that we're all sort of collectively thinking together. And then another one of those arts-based units will forefront poetry in the way that Irania has talked about, and then have them experience that. So those are the things that we're so excited about having in the works. Next slide, please. Along with creating these modules, we're doing some self-study. We're really curious about how we learn together. So these folks who have a medical focus and us who have ourselves coming from all sorts of creative, word-centered ways of working. And so it's so interesting to see the ways that things just mesh completely, and then other ways where it's like different perspectives on the same thing. And so we're trying to look at the richness of that and really have explaining that and sharing research about that also be just as important as the play. Next slide, please. Next slide, please. So we're always learning. And so some insights that we can take away at this point. I mean, it's been going on since 2018, and we keep learning new things, and we will continue to learn new things. But a few things that have really risen to this point are we've continually asked, like, whose voice or perspective is missing. And I think it's so important that this is multivocal, multiple perspectives, but there are always voices of folks who are not there. And so this way of working can be adapted for different settings, perhaps in a place where women are less comfortable to talk about or even allowed to talk about their bodies, or for men with breast cancer. So we want to make sure that it's not like this is it, but rather this is a beginning. As Irania said earlier, process matters. We think it's about making the play or writing the poem or having the conversation, but really it's what's happening in the going along that matters. the art of collective curation, like the example for us is our Facebook page. It wasn't, I put it together and this is what it is, or this is what Irania put together, but we sort of made it a place where people can join in and add their ideas. We featured each one of the actors who were able to join in and talk about their experience. Like, for it to be collective, it's really just as beautiful, I think, as the play itself. And then the stories of navigating medical system language, cultural, social, and economic borders are universal. And often we'll think that the language barrier is it English or is it Spanish? But really, even if somebody has the same home language as you and they speak medical, it feels as though it's from far away. And I think, the last point, we know this from education research, that we spend our time unvaluing creativity that is innate in children. And by the time we get to adulthood, people really do think they are either creative or not. And we know from brain science that everyone is. It's just, you need the opportunity and it needs to be supported, but it holds space for diversity and complexity. Next slide, please. And so this is a little bit of a reiteration of things we've already said. Who's still missing? How do we build relationships with the medical community and social services interested in this? And how do we get a fully mounted production to happen? Those are things that are on our radar, but we hope that in sharing this, there are things that have sparked for you and that you see possibilities of connecting with us in some way in wherever you call home. Next slide, please. There we go. Irania?
Yes, that's the big question for all of us here in this space. Voces Unidas, really, which is actually a very beautiful title for what we're talking about. So how can we and how can you get involved? How can we feel this is a process that belongs to all of us, whether you are coming from the medical community, from the research aspect, from the library world, from I'm not sure who is in this space today, but I'm pretty sure, and that's what we're looking to ask you today, is how do you see yourself involved, or how do your industry, where do you work for, can see Tatas Tales, a project that can enhance your mission, that can improve your goal, that can make you, a better person, a better professional. And that's what we're here today. So in the next slide, it's really now our time for you to, what are your questions? What are your takeaways? We would love to hear from you. I know at the end you have our emails. And like Beth said, we don't want this to be just a product that is just a beautiful play where people and the families of breast cancer survivors can see themselves. It has so much potential for the connection with education, curriculum development, expose voices that are not represented. So this is now your turn for you to give us your feedback. And thank you for listening.
Okay, can you hear me? Perfect. We have some comments here. People find this powerful, touching, beautiful, and I will let people to think if they have questions, but I have some, so I will ask you some questions. First, how many sessions were done training the library staff?
How many sessions were done through the
training the library staff? To train library staff to participate?
That's a good question. The one who conducted in the library, Tatas Tales, it was just me.
Okay.
However, there is a training that we have been doing through the North Carolina State Library on bibliotherapy and poetry therapy as strategies to work with marginalized communities and in connection with social emotional learning. And so there is a training, and then people can apply these tools to the population that you are, that you're working to, the at-risk communities that you're working. But for Tatas Tales specifically, to do Tatas Tales, it was just me as a poetry therapy facilitator.
Okay. Okay.
Tanya, can you talk about how on staff day, what you did?
Yes, we twice actually for the last two October month, but with this breast cancer awareness month, through the library, we have done these as part of the professional development training. So we open up, we read the script, and then we open up these for the librarians and the program librarians, or any librarian, to react toward these lines. And also we have kind of a conversation, how can they adapt these to the regular programs. But there is a training in place, not only for Tatas, not specifically for Tatas Tales, but for strategies on how to use
Okay.
performative writing and poetry therapy to use in marginalized communities.
Oh, that's nice. I want to ask you also about how the faculty that work with you, public nurses and the public health professionals, how they reacted in terms of their experience for their process of their own learning, teaching and learning process for their own students.
Yeah, it's interesting because I think one of the nurses comes at the work talking about her own experience with her mom experiencing breast cancer and having a not very good experience in a couple of medical situations. Others look at it like they really want to be able to help their students get past remembering what the diagnosis is or what all of the symptoms are, and think about it as this is a person in front of me. And so I think different people see different possibilities in this, but I think all of it is about how to help the students who are current or future nurses open things up to see people, not textbook material.
Fantastic. I am seeing it in that light. I am in a medical sciences campus, so I see the possibilities for teaching and learning. Our first year medical students take a seminar on social determinants of health, and this presentation would be ideal for them to conceptualize the problem from the patient's point of view. So I am going to there to ask you if you will be willing to offer a webinar for our library. I would love to, because I think faculty and students could learn a lot with this thing you are doing, this program and these trainings and this therapy you're doing with your patients, with your cancer patient. The
Thank you,
humanities in your, well, I don't know if anyone have any more questions. If we see the chat, I think that's it. If you can add anything, we have 2 minutes.
I just want to tap into the idea of the power of working in the multidisciplinary forms, and this is a project that tap into an artistic process. It taps into the world of libraries, and it taps into the medical community. And I think the more that we can collaborate, and we sometimes underestimate the power of something like the arts or something that is completely far away from research, and knowing that the tools that theater and writing and the world of outreach in public libraries in connection with mental health it's a powerful tool. And I think, we should open up to more and more initiatives like this. And so these are our contact information, Irania Macias. I have iraniapatterson@gmail.com, and that's Beth's email. Any other question or comments?
They are saying thanks for being part of this. Of this Beth. And thank you for inspiring, informative, and dynamic presentation. So thank you very much.
Ma'am, I have a question.
Okay.
This is Angelica Carrillo, and I live in Texas, and so I work in a geriatric clinic, and so I just wanted to ask, because I wanted to initiate a caregiver support group for caregivers who are Spanish speaking. And so I'm having a little difficulty with recruiting, but I also wanted to ask you, how would you see maybe this being incorporated to a support group for caregivers who have loved ones with dementia? Because at the same time, as dementia progresses, they're sort of losing their loved ones because their family members, of course, is not the same person. So I just wanted to ask you, how would this program would be interact to a support group or with caregivers with dementia, if you don't mind me asking.
I think
hello?
I think there's natural connections there. And I'm sure
Mhm.
Irania, you should reach out to Irania separate from here. But I think that the way of working, of getting people to respond to a piece of literature and then tell their story. And I think a caregiver support group could be really a powerful, powerful thing. And I would say start small too. Like getting people recruited is hard, but once you get a couple who really find it good, they're going to bring in other people. And I think if you
Right.
look at existing groups, maybe it's like, hey, can I come into your existing group and can I do something for 30 minutes and try it out, and you'll
Right.
see and they'll see, and, everybody's learning. I don't know if
Okay.
that's helpful or not.
Yes. So I'll reach out to you guys separately. We do